The government of eSwatini has long refuted media reports that the nation's King Mswati III was critically ill with COVID-19. Now, according to the Prime Minister of eSwatini, the king has addressed the nation, rubbishing reports that he was on his deathbed. He also touched on the arrival of Taiwanese medical doctors in eSwatini to help fight the virus. Let's take a listen.
As you are aware that the entire world is engulfed by this pandemic, our kingdom, the African continent, as well as other continents are affected directly by the coronavirus. This pandemic calls for all citizens to abide by the coronavirus restrictions because if we fail to do so, the situation can spiral out of control. I've been receiving updates from the Prime Minister and the COVID-19 task team on the measures we have taken as a country to fight this pandemic. I would also like to thank the entire nation for the cooperation they have displayed during the course of our partial lockdown. The WHO is always encouraging us to practice safe, healthy measures across all countries, and they have also advised us that for the pandemic to be defeated, we need to ensure that we always cover our faces with masks. It is imperative for each and every citizen to wear a mask at all times. We also need to wash our hands with soap and running water, which can be alternated with alcohol-based hand sanitizers.
And we're joined now by Sabelo Dlamini, eSwatini government spokesperson, to talk more about this. A very good evening to you, and thank you so much for speaking to us. Now, very difficult, obviously, to say why and how, but to your understanding, where do these rumours emanate from that the king was on his deathbed as a result of COVID-19?
Thank you for the opportunity to address you and your listeners. It is very difficult to know how these rumors come about. But in these days of social media and technology, people are able to just create their stories and write whatever they want to write about whatever topic is there at that particular time. So we did see those reports emanating from particular social media sites alleging that His Majesty was ill. Fortunately, government was able to issue out a statement and confirm that His Majesty is well, His Majesty is very healthy. And today, I'm happy that you can confirm yourself that His Majesty is well and he is healthy. And today he came out to address the nation and thank eMswati in their entirety for following the precautions that have come about from WHO and the Ministry of Health, encouraging people to either stay at home, take precautionary measures like washing their hands with running water and soap or using alcohol-based sanitizers. And in fact, the king lamented that unfortunately the pandemic came at a time when the economy of this country was starting to stabilize. It came with the unfortunate scenario of reversing some of the gains that the economy had already made. But he advised government to continue with the programs of fighting coronavirus, at the same time ensuring that the economy lives and that the lives and livelihoods of eMswati are well protected, and eMswati have all the opportunities to grow and be a stable nation.
And I'm just looking at the graph of not only the active cases, but also the number of positive cases. There's been a spike from March 22 to the last day, which we can look at, May 6, which is yesterday, and 2 deaths that have been reported. Are you concerned that there seems to be a rapid increase?
It is very concerning that there is a rapid increase of COVID-19 positive cases in the country. But we have to put some matters into perspective. The Ministry of Health and Government has intensified testing. You will know that in eSwatini right now we have a testing laboratory. So we're able to test from our own country. We do not have to rely from other foreign laboratories to test our own people. The ministry engaged in an expanded program of testing a number of people at a time. We are able to test more than 100 people a day. And a number of regions have been zoned. We have red zones, we have yellow zones, and we have a green zone. What is happening right now is that the Ministry of Health is concentrating on increasing testing in the red zones. In particular, in this country is the Manzini region and specifically the Manzini town and surrounding areas, where we see a high number of COVID-19 cases which are appearing. It is concerning, but government is putting all the measures in place to ensure that the situation is normalized. A number of health professionals are now fully trained on COVID-19. Government has recruited hundreds more of health workers to help in this fight against COVID-19. The country is also receiving a lot of assistance from a number of countries and our donor friends who are helping with equipment, especially screening facilities, masks, and a lot of other equipment. And the country continues with another program of screening the public, especially in roadblocks, in informal crossings, in clinics. In a way, thousands of people have been screened, and those who are found to be showing signs of COVID-19 are then taken for testing. That's why you're seeing this spike in the number of people that are testing positive. In effect, is that our testing has been increased and expanded to all regions of the country in a very, very systematic way.
What has been obviously of concern has been the health of those who are vulnerable, as is the case here in South Africa and other parts of the world. And I want to talk about the areas which you consider as hotspots. Eswatini known to have areas with abject poverty. Which are those areas and what are you doing about it?
Indeed, there are a number of people who need food assistance, especially in this time, because the partial lockdown has come with the measure to make sure that people stay at home. So government has been rolling out a program which in fact begins tomorrow of providing food to the most vulnerable of our society. Government is working together with members of parliament and with other NGOs around the country to provide food and assistance to all those who are vulnerable in our society. Beginning tomorrow, they'll be receiving some food parcels. Others will be receiving a transfer of money into their accounts just to ensure that they're able to survive while the country goes through this process of a partial lockdown.
Thank you so much for speaking to us. Sabelo Dlamini is the Eswatini government spokesperson, refuting claims there that King Mswati III is extremely ill as a result of COVID-19, saying that they not only have a handle on the situation, but they're doing their best to keep it under control.